people a few more minutes to join the session, and we'll get started in a few minutes. Welcome to the Illinois State Graduate Student Town Hall. This is the second Town Hall event that we are hosting, and we are planning to offer these once a month so that graduate students can interact with the graduate school and as well as hear from select panelists based on the discussion that we may be having for that month. My name is Dr. Noelle Selko, and I am the Interim Director of the Graduate School. Joining us today, we have some esteemed guests who have been at the forefront of fall planning and have been leading several of the task force. And they will sort of discuss some of their organization and strategies for where we currently are, and sort of just so that you as students can hear from those that have been involved in some of the decision making and the communications that have been distributed to campus. I'm going to start today by having them introduce themselves. Then we will go over our agenda and go over our various topics. One thing I do want to point out is that the information that you are hearing today is what we know currently at this moment. As we know, in the situation with the global pandemic, things can change very rapidly, and we will certainly update information as changes may occur. To start with introductions, I would like Dr. Yazedjian to introduce herself.
Hi, everybody. I'm Ani Yazedjian. I'm the Associate Provost here at Illinois State University. I'm happy to be here.
Dr. Hurd.
Hi, I'm Amy Hurd. I'm the Associate Vice President for Undergraduate Education. And for those of you who have been around for a while, I was with the grad school and came over to this position about 1.5 years ago.
Dr. Catanzaro.
Hi, I'm Sam Catanzaro. I'm the Associate Vice President for Academic Administration. I'm also a professor of psychology.
Eric.
Eric Hodges. I'm the Director of Emergency Management for the university.
Not to put him on the spot, but I'll have Dr. McLaughlin introduce himself only because he is new to this position and he does have some influence into the graduate school.
Hi, I'm Craig McLaughlin. I'm the Associate Vice President for Research and Graduate Studies. I'll take a very secondary role. Dr. Selko does all the hard work.
We also have several members in the background that will be answering questions as you may have them during the presentation. So please use the Q&A feature available to ask questions throughout the presentation. And there will be a moment at the end of our presentation that will be open to questions that we will take directly from the audience. So to review our agenda for today, we're going to start with the fall 2020 semester and discuss the plans that we currently have in place. We'll discuss international students and some implications, health and safety, offerings that the graduate school will be providing to graduate students, additional resources available on our campus, and then an opportunity for you as participants to ask questions. So to begin, Dr. Yazedjian and Dr. Hurd will discuss the fall 2020 semester.
All right, so I'll go ahead and get started with this one. As Dr. Selko said, the planning for COVID-19 has been fast moving and it changes in an instant. We head down one path and then we learn something new and we have to head down another. So it's made for some interesting discussions, and it has been difficult to plan. And we've been doing this since the end of February. So I just want to give you a brief overview on where we are and where we've come along the way. As you have been able to tell by watching your schedules, we've made 3 different significant changes to those schedules. The first time in June, we wanted to put more classes online to help de-densify campus. As we learn more along the way, in the start of July, we decided that we need to get some more classes online to further de-densify as we're watching the numbers increase a little bit. Then a week ago, we decided that because we couldn't test at the level that we needed even more classes to go online. So we made a decision to move those classes online that could be moved online, and those that needed to be face-to-face based on an experiential component to them would remain face-to-face or hybrid. Right now, about 58% of the grad classes are online. I'll talk a little bit more in a bit if we think that that's going to change. But before I do that, I want to talk a little bit about the Redbird's return plan. If you have gone to our main landing page and you see that there's a coronavirus link right off to the right that you can get lots of information about what's going on. The big thing is the Redbird's return plan is there. That gives you an update on where we are with all of the planning. And as we accomplish more things, we update that plan. So the question is, how was that developed? Well, there were approximately 16 work groups that have been busy since the end of February, as I mentioned. And those work groups, they span all operations of campus. Academic continuity is the one that Dr. Uzagian and I chair. That is dealing anything academics. So the courses and policies and procedures and those sorts of things. We have work groups on events and facilities, employment, equity, and inclusion. So we have people working on all pieces of this. A lot of work has been done over the summer. Ani and I have met with over 4,500 people just to talk about what the planning looks like. You may be aware of the governor's Restore Illinois plan. There are 5 phases within it. Right now we're in phase 4. Well, the governor's office will be watching numbers and may move us back to phase 3. We can't wait to get to phase 5 because that is when things are pretty much back to normal. So you may be wondering what's gonna cause us to move more classes online, or what will cause the governor to change phases? Well, it's not going to be just one thing. We're going to look at a lot of different things, and the governor will be looking at a lot of different things. They're going to be looking at state and local numbers. We'll look at federal numbers, refer to the CDC and Johns Hopkins and all those different resources that we are monitoring nonstop. We're going to look at the number of students we have in isolation and the number of in quarantine. And we may reassess whether we can just keep going as planned or if we need to put even more classes online. Another issue you may be concerned about is technology and what kind of support is there. Hopefully you have taken a look at the Redbirds Keep Learning website. If not, go to the coronavirus page and it's linked there. There's a lot of good information there that will help you, and a lot of questions that may be answered. One of the key places, if you have technology questions, is called ithelp.illinoisstate.edu. You can ask questions there. If you feel like you're having software issues, you can't get access to software, you're having some computer issues, they can help you. If you're a GA and you are in need of some support, see your department chair first and they'll connect you with the IT director within the department.
Sorry, Amy, if I could jump in.
Yep.
Sorry. Going back to the question of if you're a graduate teaching assistant, if you are in need of a microphone, two very specific things, a headset, three, headset, microphone, webcam. As Amy said, reach out to your chair and director or director, who will then reach out to your college IT person, and then the university will be able to provide those three very specific things. So other needs, feel free to talk to your chair and director as well, but those three the university can provide. Thank you.
Good. Yeah, Ani and I tag team a lot of things. So next time I wanted to talk about quickly was courses. And our online courses, they're going to be either asynchronous or synchronous. So synchronous is that the whole class will meet at the same time, and asynchronous, it'll be more self-paced based on the deadlines the instructor provides. Now, how are you going to know that? There are a couple of ways. First of all, hopefully your faculty member will reach out to you. If they haven't, then you may want to reach out to them. You can also find this information in Course Finder. It is not going to be listed on your schedule when you go into You'll have to go clear to Course Finder to take a look at that. And that will provide some notes as to how that course may be delivered. But your faculty member will be the one that has the best information, since they're the ones offering the course. We also plan to have some study rooms available. You know, the library, we had to obviously de-densify it a little bit because we have to account for the 6-foot physical distancing. So we had to reduce the capacity of the library and move out some tables and chairs and things. So there's not going to be as much space to study. We're going to be opening a room in the Bone Student Center. The Prairie Room 3 will be open for study space. But this might not be enough space for you all. So we're looking to open some study rooms in different facilities. We're finalizing the schedule and should have that all together by the end of the week, and then we can notify you where those rooms are going to be. And the last thing that I wanted to mention is spring 2021 planning. We're looking at several options right now. We've looked at having students have a test again before their COVID test before they come back to campus. We've talked about starting remote for a couple weeks. We've talked about different configurations for the semester. Right now, we don't have any solid plans on what that's going to be. We are going to learn a lot over the next couple of weeks about how the fall schedule starts. And once we get fall underway, then we'll go back and we'll start working on spring. We plan on getting a lot of input on that and seeing what works and what didn't work, and then making plans from there. So that's all I had on the fall 2020 semester. And so as questions come in, we're happy to answer them.
Thank you. Moving to our international students, new students that are attending on campus will need an in-person or hybrid course as well as their valid visa. As Dr. Hurd had mentioned, in Course Finder, that is where you will be able to know what your class is designated as. And in-person or hybrid meets the requirement for on-campus instruction. You do need to enroll 100% online for the fall 2020 semester if you are not here in the United States. You could also defer your admission to the next available term, and you would contact international admissions to help with that process. As far as late arrivals, so again, with the changing climate, we know that visa appointments, we know students have them scheduled this week as well as going into next week. Students are wondering when they could come on campus. We are strongly advising to be on campus by the first day of classes, which is Monday, August 17th. And if you feel that you cannot make that date, please reach out to international admissions at your earliest convenience for options for you. A note about transfer students. So international students who are transferring to Illinois State, and this will be their first semester on campus, you will follow the new student guidelines, which means that while on campus, you will need an in-person or hybrid course. You only need 1 credit hour of an in-person or hybrid course to meet the requirement, but you do need to be enrolled full-time, which is 9 hours as a graduate student. Continuing students can attend in all 3 formats of course instruction: in-person, hybrid, or online within the United States. So there is no specific requirement of having a certain number of courses in a certain classification. You could be 100% online from inside the United States as well as outside. I'm going to have Eric Hodges and Dr. Catanzaro talk about the health and safety protocols on our campus.
So good morning, everyone. We realized all throughout this that it's going to take everyone working together in order for us to successfully get our way through this and on to the eventual vaccine. And this becomes more of a memory than a burden for everyone every day. And part of that is something that we came up with called the Redbird Pledge, which is an opportunity for everyone to indicate a bit of personal responsibility and kind of sign off on that, indicating that I'm going to do my part in this fight against COVID-19. So that is out on our coronavirus webpage. You're welcome to sign it, print it. We've had quite a few people already do that. So it's purely optional. It is not a required piece at all. But if that's something that you're interested in doing, we encourage you to take a look at that on the COVID-19 webpage and sign it if you'd like. Cleaning protocols. We have put a lot of effort and time into enhanced cleaning on campus. So a number of things here. First of all, our facilities department has done an amazing job in sourcing as much hand sanitizer and wipes as they could find. So in the classroom, what you're going to find are approximately 3-gallon buckets. And you may have seen this in some of the promo videos, but those 3-gallon buckets have a little opening at the top, and inside there are hundreds and hundreds of wipes. So it's like a small little container of wipes that you might have, like a plastic bottle. It's only 3 gallons in size, so it's huge. So this allows anyone that wants to take a wipe or a couple of wipes, clean down their space before and after using it in the classroom. There's that. In addition, facilities already been doing enhanced cleaning of high-touch surfaces on campus, doorknobs, elevator buttons. For a while before we shut a lot of them down, drinking fountains, light switches, places like that are getting cleaned more frequently. Restrooms getting cleaned more frequently. So we're doing that. Facilities is also hiring additional temporary staff to make sure that places like classrooms and offices get cleaned more often as well. So there will be a lot of people doing cleaning on campus, but all of us will be as well. We're all encouraged to wipe down our spaces, clean our spaces. Facilities will do their part in this. So everybody kind of has a role in the cleaning. Hand sanitizer, those stations have already been installed at least 1, if not 2 entrances to every building on campus. So when you go into a main building, you should see a hand sanitizer station fixed to the wall. So we have a couple hundred of those out there. Facility is going to do everything they can to keep those filled, but that is 100% based on their ability to get the product from the manufacturer, which is tough right now. But they have some pallets in stock, so those are out there as well. Individual little hand sanitizer bottles, you may see some of those around. Those are being handed out in university housing, so they're out there. Mask requirements, I'll start on this and then hand it off to Dr. Catanzaro to talk a little bit more about how that might work in the classroom. If you didn't know, the university is providing one of these to everybody on campus, all faculty, staff, and students. If you live in the residence halls, they're going to be provided specifically there. If you don't live in the residence hall, there will be a tent in front of Schrader during all of Welcome Week. And so that's where you'll have an opportunity to pick up yours as well. So in addition to that, obviously everyone on campus is going to have a requirement to wear a mask, whether they are inside of a building or outside of a building and can't maintain that 6 foot distancing. That's kind of the blanket for everyone on campus. And there's little nuances, like if you're eating in a particular space in a dining center, then you don't have to wear a face covering, during that period. But there's little one-offs here. But in general, there is a requirement to wear masks or face coverings on campus. Now, for more of the specifics in the academic spaces, I'll turn it over to Dr. Catanzaro, and then I'll pick it back up with testing after that.
Okay, thank you, Eric. Good morning, everyone. So to pick up right where Eric left off, masks are required in all indoor public spaces, right? And that includes classrooms. So students are responsible for bringing a face covering and wearing it in the building and in the classroom. Classroom seating will be physically distanced, and that will help, but masks are required. Individuals who need accommodations for documentable reasons can work through the Office of Student Access and Accommodation Services to figure out how that will work for them. But we will not be we are going to protect the community, so the accommodations will not include being in class without a mask. We have clear masks available to facilitate understanding, especially for students who might be deaf and hard of hearing. Those are available to be distributed when needed. And that, of course, is for the folks around them, not in class, not necessarily just for themselves. Instructor responsibility is, an instructor, if you are an instructor, you may inquire if a student arrives at your class without a face covering. You may remind them of the policy. We will have available disposable masks, and we're working on a distribution system so you can get a supply and have them with you when you go to class if you're teaching face-to-face. And that, of course, includes face-to-face sessions in a hybrid course. And, what we're encouraging people to do is to take a collegial educational approach. We're all educators. The procedures in place because there's scientific evidence that wearing masks reduces the spread of this virus. For both the wearer, and that there's some newer evidence on that, there is, but also for the people around the person wearing the mask. So you can offer masks to individuals who have forgotten them or didn't bring them. If they object to wearing a mask, what we're recommending is that you, from an appropriate physical distance of 6 feet or more, ask what their reasons are and try to be responsive to those reasons. But we're not making exceptions on the spot. You don't have to feel like you're making exceptions on the spot. We're going to be disseminating some information about encouraging folks to sort of have a backup plan, whether it be a professor is teaching nearby that you could call, or a department chair or a grad coordinator. We're not going to specify who that person should be because it might be different depending on where you're teaching and what your geographic context is. But thinking about having someone who can come and help you deliver that message and stay firm. With the sort of last resort, the second to last resort would be telling the student that they have to leave. They cannot attend class that day if they insist on not wearing a mask. If the situation gets more tense to the point where you're concerned about safety or something erupting, certainly you can call the ISU police. We only recommend doing that if it is really a situation where someone is breaking some other rule, not the face coverings rule. And in a really extreme situation, you might want to dismiss class, but we're not encouraging that because we don't want to disadvantage all the other students for, you know, a small handful of students who might refuse to wear the face covering. We're going to be laying out those steps before classes start meeting and providing folks with an opportunity to sort of think through and have their plan. Do you want to talk about testing now?
You good? Okay.
I'm good.
I will pick it back up with testing and contact tracing. A couple of definitions. Asymptomatic testing, symptomatic testing. Symptomatic testing means I am showing one or maybe two or more of the symptoms of COVID. Therefore, Student Health Services would order up a test for you. It's the same test. The test is exactly the same, but what's different is how we're approaching those and our protocols for that. So Student Health Services is the place that the students will contact if they have symptoms and want to get a test, or the doctor or physician there orders the test. The test that we're using, there's several out there, but it's the non-invasive nasal swab. Non-invasive being the key. It's not the shove the thing all the way back down the throat, not that one. This is the one that just goes in a little bit, and it's not that big of an issue. And then we have a couple of partnerships in place within the community that we should be able to get those results in about 24 hours. In some cases, once we sign another contract, hopefully less than that, about a one-day turnaround. So Student Health Services is the conduit for symptomatic testing. The other kind of testing is asymptomatic testing. I don't have any symptoms, I just want to get a test. Or surveillance testing, which we want to test, we want some percentage of our population to be tested every day or every week or something like that. Regular ongoing testing for the purposes of finding hotspots and addressing them before they have an opportunity to become something much bigger. So on that front, we've put out a request for quote week and a half ago, maybe 2 weeks ago, for various partners to assist us in that endeavor. And there's a Board of Trustees item for tomorrow night for them to consider a proposal to partner with a lab that's already doing some work in the community. They're actually running the site in Bloomington Normal for our whole area. And they've offered to come on campus and run a couple of sites for us as well. So the intention is, if this gets approved, that we would run a couple of fixed sites on campus, have a sign-up opportunity, and people would be able to go and get surveillance testing or asymptomatic testing on campus. The university will pick up the cost for those, so there will be no cost to the student for that service as well. Now, this is probably just going to be for people on campus and in the community. We're not going to encourage someone who's online and maybe living up near Chicago to drive down and get a test. This is for those that are here being, you know, right around here, on campus, in town, something like that. Contact tracing. Up to this point, the McLean County Health Department, we are in McLean County, so the health department has been running all the contact tracing on campus. They have recently expressed an interest in hiring some additional contact tracers and dedicating them to us, and even locating them on campus or right nearby campus. So that's a conversation between the McLean County Health Department and Student Health Services, figuring out exactly what that's going to look like. So a couple of questions that have come up is, well, one popular question. Someone in my class, someone in my office, someone on my sports team, someone in my club, someone on my residence hall floor tests positive. So wherever, you know, whatever that grouping is, someone tests positive. When am I, the classmate, the teammate, the floor mate, the club mate, going to be told? How's that going to work? So that likely will not happen. So what can't happen is if we're all in a class together and I test positive, you all are not going to get an email the next day saying Eric tested positive. That is a HIPAA violation. It's healthcare protected information. What happens instead, so here's what happens. The health department finds out from whoever took my test that I'm positive. The health department contacts me right away. And they initiate this contact tracing questionnaire. And it is a very regimented process of going down that questionnaire by a trained person. Not just anybody can do this, but a trained person, and tries to figure out who my close contacts are. So what's a close contact? A close contact is anyone that I've been around for 15 or more minutes in a row within 6 feet. So I rode in a car with somebody across town. If that was more than 15 minutes, whether or not we were wearing masks or not doesn't matter in this case. That's a close contact. I'm a roommate with someone in Waterston Towers. That's a close contact. I am in a class with somebody, but as you heard others mentioned earlier, those seats are 6 feet apart from each other. Or I'm the faculty member in the front of the room and I was not within 6 feet of the person. I am not a close contact. Maybe nobody in that class will be a close contact. The key to this is 15 minutes within 6 feet. That's the definition of a close contact. So the health department is going to go back somewhere between 48 and 72 hours in the past to find out who my close contacts might have been. And in theory, not in practice to be honest, but in theory, if we're doing all of this right and we're maintaining our 6 feet from each other, I should at the end of that conversation come back and say that I had no close contacts. There were none. Because in my office, in my classroom, when I went to the dining center or wherever it may be, I was not within 6 feet of anybody. So that's what the health department is trying to do. Then they contact those. So if there is anyone on that list, that's who they contact. And they say, you have been identified as a close contact of someone who has tested positive for COVID. They do not say, you are a close contact of Eric who has tested positive for COVID. You are a close contact of someone who has tested positive for COVID. And then you go and get tested sometimes within that in a 5-day period, and you undergo a 14-day quarantine period. So that's how that works. To be perfectly honest about how things have worked so far on campus, we've had very, very few cases so far, because we've had a lot of these practices in place. So there haven't been a lot of cases on campus. So I know there's a lot of questions around this. So I don't know if we want to wait till the end or wait till the end and go on to the next slide.
Yeah, we'll wait to the end and then
Okay.
we'll open it up to everybody.
Very good. Thank you.
Thank you. So regarding what the graduate school is doing as far as some resources and information to share with our graduate students, if you are a graduate assistant, an email was sent on July 31st explaining options on where you are residing, whether within the United States or outside the United States. If you have not heard from your graduate coordinator and you have concerns about your graduate assistant position, or if you haven't heard from your graduate supervisor, please contact them so you do know your options and what is available to you. Most units are providing some remote options, but unfortunately, due to the nature of some of the work, there is some in-person requirements for some positions. And so we want students to know what their options are as far as the positions available to them. Research is still being conducted on campus. So even though we may be having more online courses, students are still able to be on campus and conduct their research. So whether that's for a thesis or a dissertation, a project with a faculty member, do know that you can still be on campus to conduct that research following physical distance guidelines. Regarding our thesis and dissertation deadlines, we do want to stick to those as closely as possible because it does allow for time for final review by the graduate school, as well as getting all information to what we call a clearinghouse to process final conferral of degrees. However, we know that there are unique circumstances, and on a case-by-case basis, a student and their committee chair can work with the graduate school on a new timeline as needed to still meet the requirement for fall or spring graduation. The key thing here is communication. As soon as you know that there might be a delay, please work with your committee chair and your committee, as well as the graduate school, on finding out what your options are. As far as networking and communication correspondence with graduate students, we are providing a weekly email just as we did last year. So for students who are new, you will get an email actually later today. We send out our weekly newsletters on Tuesdays. We try to get those out before or around the noon hour so that students can stay up to date on current information going on around campus as well as within the graduate school. Within that newsletter, we will advertise professional development workshops. We also have a monthly competition called Grad Scholar, where students can self-nominate any type of research that they are doing, a creative work, a creative endeavor. It doesn't have to be a thesis or dissertation project. And then students are evaluated by a committee, and then they receive a monetary prize each month. We will also be hosting monthly boot camps. These will be probably between a day and a half to 2 days. Opportunities for students to just set aside some time for writing. We will have some small interactions on some selected topics, such as procrastination, motivation, mentoring. But really the idea behind these boot camps is really just to allow a student to put some dedicated time on their calendar and allowed to interact with other students, commiserate, ask for advice, maybe some advice on how to overcome a writer's block. But we will continue to offer those or start those once a month. Once a week, we will be hosting a coffee hour with the graduate school as a way for students to ask questions, also as an opportunity for students to just interact with other students on campus. Depending on how many students join, we will utilize the breakout feature where students can sort of interact with one another in a small group. As I mentioned, we will offer monthly town hall events. As I'm sure we have been aware and accustomed to, as it's been mentioned previously, things change very quick or can change very quickly. And we do want to keep our students up to date and have the opportunity to ask questions. You certainly do not have to wait for a town hall event to interact with anyone. On the last slide will be contact information to the graduate school as well as the coronavirus website. These are other opportunities for you to ask questions whenever you have them. We also utilize Facebook and Twitter to advertise various opportunities for our students on campus. So while we will be offering more virtual environments for our students, we do still want you to feel that there is a connection to the graduate school as well as the ISU community if you are not able to be here physically on campus. As far as our resources on campus, Dr. Yazedjian is going to discuss some of the various resources available to our students.
Sure, thanks, Noelle. I'm not going to go into all these specific ones, but just to speak more generally, that Student Access and Accommodation Services has been working diligently this summer to really think about how their supports might change as we transition into a more virtual environment. So if you're in need of those services yourself, feel free to reach out to them. But also, if you're a graduate teaching assistant, do know that it is the student's responsibility to start that process with SAS, and then you would be getting documentation from SAS as a graduate teaching assistant. Some of you might already know this, but I think it's worth repeating so that you're not in the position to have to determine what accommodations a student may need in your class, but SAS will provide those that information to you in the notification that you receive about the particular student's situation. We're also very aware about the impact of the pandemic on mental health and well-being. So student counseling and the need for student counseling, either for yourself or for, again, students in your classes. So student counseling services is looking for additional opportunities to provide services, whether it is contracting with a third-party provider to provide additional resources. Also, they are going to try to do a lot of their sessions virtually, but if you don't have access to a private space to do that, there are Zoom rooms. There's a Zoom room in student counseling services where you can go and participate in your therapy, but in that private space or through your own phone or your own device. But just to know that there are going to be additional resources available for you as a student, but also for students in your courses if you're a GTA. So feel free to look at their website. The same thing with student health services. You know, everybody, as Dr. Hurd said earlier, has been working really hard over the summer to try to figure out new and innovative ways to provide services to meet your needs as a student at ISU, but also if you're a RA or a GTA or other graduate assistant on campus. The Center for Teaching and Learning, I noticed that there was one question in the Q&A that's already been answered, but bears repeating. CTLT did develop a series of resources for faculty and instructors, but then also put together the same or a similar kind of set of resources for GTA. So you should feel free to access those as well. The other thing, Noel, do you want to go to the next slide so we can show the search? There are a lot of resources on campus, and the folks in IT have decided that this is the best way for you from your student perspective to get the resources that you need. So you can log into myillinoisstate.edu. You'll see that there's some Latin language in that slide, but that's still because it's a draft. So by the beginning of school, you'll be able to log into It'll be much more user-friendly. We've had students testing this out throughout the last several weeks, and then you'll be able to use that search bar to find the resources that you need. If you are a GTA and you're looking for resources, go to the Redbirds Keep Teaching website, which will include several other resources, kind of all put into one place for you. I'm watching the time, so I'll stop there and turn it over to Noel, but I'm happy to answer other questions as they come up. Thank you.
Yes, and due to time, we do want to open it up to the Q&A. So do know that if you do have some questions on voting or health insurance, to please let us know directly. We will also bring these back up in our September town hall. So at this time, Rachel Karachi from the Graduate School is going to moderate our questions from the audience, and then she will directly ask one of the panelists or a few of the panelists to answer that question.
All right, well, hi everyone. So yes, there are a couple of questions coming in, and the first question that has come in that I do want to have addressed in a live setting is, can professors take more students than what's allowed in class? You know, I know that since, you know, there are generally class capacities, and now with classes going online and physical class size maximums and fire safety necessarily won't be an issue. They're wondering what professors can genuinely do when their classes are full, but more students want to be added in. Not sure who to best answer that.
I'll take that one. So if it is a face-to-face class, the faculty will know what the room capacity is. They should not exceed that room capacity because, as Eric stated, those seats are set at 6 feet physical distancing. If we get them closer, we run into contact tracing issues. So the faculty will know how many they can take. Our faculty don't benefit from having a larger class size, so that is a non-issue for us. If it is an online class, the faculty member, the advisor, and the chair will talk about whether they can increase the size of that class or not. So if you are teaching that course and someone wants to get into your class, go see your chair and they'll help you work through that.
Okay, thank you. Can someone also then talk about if there is a potential refund opportunity since general fees are not being used necessarily for facilities, or then if they are being moved to online, what that fee would be going towards?
I mean, I can jump in with a non-answer. You know, that really is a discussion that is going to be made at the that's going to be had at the cabinet level, and a decision that will be made at the cabinet level. One thing I would say, and I don't want to get into the nuances of different fees, but some of these fees exist whether a person uses it or uses a physical space or not. So I definitely understand. You know, I was a student for many, many years, so I definitely understand the people's opinions about this, but just to say that there are discussions about it. You know, there might not be a different decision, but we are aware of students' thoughts on this and looking at the situation. But again, you know, you have buildings that still need to be maintained. And then the other thing that students will talk about is online education and how that might cost a different amount. But really, you still have faculty who are getting paid, and you still have other technological resources. And those of you who are GTAs know, you know, there are other resources that need to be used when a class is taught in an online format. So there are still expenses.
Thank you. It looks like those are all the questions that we have at the moment. So I do want to maybe give just another minute for individuals who do have any questions that you would like to be asked during this live broadcast. Feel free to go ahead and type those in the Q&A feature. And I think we'll maybe take just one more minute to see if anyone does have additional questions at this time.
While we're waiting for some questions to come in, I did want to highlight on voting. So Election Day is November 3rd. To be able to vote in Bloomington Normal, you would need to update your voter registration to be your local address. And if you don't want to do that, you can request an absentee ballot from your home location. And then you can start voting by mail towards the end of September. And we will provide further information in our newsletter regarding voting. And then I did just want to touch on some health insurance, and that students who are registered full-time at 9 hours are automatically assessed student health insurance. There is an opt-out feature, but you would have to contact student health services in order to go through that process. And then on the opposite end of that, if you are not enrolled full-time but do want student insurance, you would have to contact student health services to purchase the student health insurance if you are not enrolled full-time.
Noelle, if I could jump in, one other thing that students may have missed, that the governor of Illinois deemed November 3rd a holiday for Election Day. So if you are a GTA and you're planning your courses, please be sure to account for that you will not be able to teach class on Election Day.
Thank you.
And I have one other comment about addresses. I'm glad you brought up the word address, because that reminded me. When we get the testing sites set up on campus and you go and visit the testing site, they're going to ask you for an ID or driver's license. And if they start writing down your address, there's a really good chance that address is not in Bloomington Normal. That's on your driver's license. It's probably back home, probably. You have to give them what your on-campus address is, because if you don't, whatever the test results are, positive, negative, whatever, are going to go to the health department for the county that's on your driver's license address, which means there's a really good chance you will never hear, and we will never hear. So we've got to do a really good job as a campus educating everyone to use your local address when you're using that testing service.
It looks like there is one other question that came in, and I believe it is from an international student, possibly. What happens to new students already enrolled and on campus in on-campus classes if ISU decides to go all online in, let's say, the first few weeks due to everything that has been happening in the county.
Hi, so I can
yeah.
take that.
Thank you.
So there shouldn't be any impact on your status if that happens. The SCVP guidance made that clear. If the entire university goes online, your status will not be impacted.
Thank you. And it appears that that is all the open questions that we have at the moment.
So I wanted to take this time to thank our panelists for joining us today. I feel the information provided was valuable, and you were at least able as a student to hear from those really directly involved with the day-to-day discussions that are happening on our campus. As I mentioned, please never hesitate to contact us with questions. As mentioned several times, the Redbird return plan as well as our coronavirus website is updated on a regular basis, and questions can be directly addressed there. And then you can certainly contact the graduate school with anything that was brought up today, and we can direct you to the proper person if needed. Again, thank you for taking the time to meet with us today, and we look forward to interacting with you throughout the academic year. Thank you.